So first this afternoon we've got probably about an hour to talk about spiritual care. So you guys will remember at the beginning of the week, one of the things I really stressed to you was that one of the focuses of palliative medicine is not just around physical symptom control, it's around a much more holistic approach. And those four spheres that we talked about, so physical, psychological, social, and then spiritual. And so for this session, I'm going to step out and leave you unattended, so please behave yourselves. But Ariel, who is a postdoc here at the university, and Cara, who is one of our chaplains here in OUH, are going to take you for this session to talk a little bit about spiritual care, what it might be, its place in healthcare, but more broadly in healthcare, how you might want to think about it now as students, in future as practitioners. Sound okay? Okay. I leave them in your gentle hands. I will be back.
Sounds good. Yeah. So wonderful to join you guys. And I also want to start by acknowledging that spiritual care can be a really intimidating subject. You might be thinking that, oh my goodness, there's so much biomedical things to learn. Now you're throwing spiritual care on top of that. And I'm not an expert in world religions, and I don't know the answer to the meaning of life. And so it can be difficult. Like if I go there with a patient, you might feel scared about what a patient will say or how you'll feel afterwards. And so I think just to start, I want to reassure you guys that spiritual care isn't that scary. And a lot of it is just being able to listen and looking out for signs of spiritual distress and spiritual coping in your patients, knowing when to refer to a chaplain. And then at the end, we'll talk about some ways that you can deal with it when a patient gives you unfixable problems that you just don't know what to do with. So, spiritual care, that's what we're talking about. 3 parts to this talk. The first is just what is spiritual care. The second is what is a chaplain. And then the third is we're going to talk about some ways that you can practice spiritual care right now, even as medical students. These are learning objectives. I won't bore you and read them. All right, what is spiritual care? Definitions. Spirituality, it's a really difficult thing to define, but in medicine, spirituality has a very specific definition. The technical definition is it's a dynamic and intrinsic aspect of humanity through which persons seek ultimate meaning, purpose, and transcendence, and experience a relationship to self, family, others, community, society, nature, the significant, or the sacred. So spirituality is expressed through beliefs and values and traditions and practices. What this means is that spirituality isn't just for religious people. A person can not believe in God, but still be spiritual in the sense of what gives their life meaning and purpose and their values.
Ariel has said it's such a difficult thing to define spirituality, and one way that I've found as a helpful way in is just to begin by thinking about our own spirituality, about what that means for us. And this is a model I quite like to use to describe it. So if it doesn't sound, I realise it sounds a bit strange, but I want you just to imagine for a moment that you are a tree and just begin by thinking about your roots. So what are the things that nourish and sustain you? What are the things that stabilise and ground you? You don't need to answer this question, but just have a think about it for yourself. This is about what resources you, what supports you, what helps you to feel safe. And thinking about the trunk of the tree, and that has to do with your core values. So what are they for you? What's your moral compass? What are the principles that you try to live your life according to? And thinking about the branches of the tree, that has to do with how we're sort of out in the world and visible and connecting with other people. So what gives you a sense of purpose, a sense of identity, a sense of self-worth? Often this is bound up with roles that we hold. So it may well be that one of the things for you that gives you a sense of identity, a sense of self-worth, is being a doctor, maybe, for example. Then thinking about the leaves on the tree. And the questions to accompany this are, what does flourishing look like for you? And another question you can interpret any way you want to. What season are you in at the moment? These are deep questions, and I'm rattling through them at quite a pace because we've got lots to cover in this session, but you might want to just revisit these questions later and think about these things a bit more deeply for yourselves. And lastly, the blossoms and the fruits of the tree, and that's about what brings you joy and what do you bring to the world. What is it that you have to offer? I would say that all of these things are part of what makes you you, and they combine to form your spirituality. They are unique. Everyone's going to come up with a different set of answers to these questions. I've done this exercise lots of times. I come up with slightly different answers every time. But they're also universal. So these apply whether or not someone has a religious faith, whether or not they would self-identify as being spiritual. There will be things for each of us that resource us, nourish us, support us, help us connect with the world, give us meaning. So I hope that's just a helpful way of unpacking what spirituality means.
Wonderful. Thank you, Cara. So why are we talking about spirituality in your palliative care rotation? You may have heard of this name, Cicely Saunders. She was the founder of palliative care, and she had this idea called total pain, where yes, pain can be physical, but also psychological, social, and spiritual. And Cicely Saunders' spiritual care was something incredibly important to her. It was actually one of the things that inspired her to set aside and create the whole hospice movement. So sometimes pain can look like this, where the pain is what you see on the top of the iceberg, but actually there's all of this underneath.
Another reason why you're covering this as part of your palliative rotation is that we know that when people are approaching end of life, spiritual concerns often come to the fore for them. This isn't an exhaustive list, but it's just a list of some of the common themes, things that often seem to matter for people as they're approaching the end of life. So space and support to grieve, putting their affairs in order, leaving things tidy, their family and loved ones. Life review, and what I mean by that is an opportunity to tell the story of their life and to evaluate the kind of life that they have lived. Have I lived well? Have I lived in accordance with my values? Reconciliation and forgiveness can be important. Sometimes there are specific goals and landmarks, so particular things people are holding on for. Legacy, so the things that people are leaving behind, and that might be material things, but also in terms of wisdom and traditions. Physical comfort we know is important, and also moments of enjoyment and beauty. I once heard a palliative care consultant say something that really stuck with me. He talks about how sometimes when time contracts in length, so when time is short, it expands in depth. And we know that, we hear that from patients, that sometimes those small moments of enjoyment and pleasure, they take on a much richer, sort of deeper dimension and importance. And spirituality and faith I've added to the list, but I want you to see all of these things as being spiritual concerns. They are all spiritual concerns.
See how they connect back to that image of the tree that we were talking about earlier. So studies show that if you ask patients and families what constitutes a good death, they'll list things like being at home, family around. But what the data shows is that patients and families say that being at peace with God is just as important to them as being pain-free. And this is remarkable if you think about it, in terms of, think about how much energy and attention we put into managing pain at the end of life, when actually the spiritual pain and spiritual care of our patients is just as important. Victoria already mentioned it. It's part of the biopsychosocial spiritual model of care, and so whole person care. And then it's also one of the official 8 domains of palliative care, recognized by the World Health Organization. So, why should I care about spirituality as a doctor? First, it affects health outcomes and decision making. Second of all, there's spiritual distress in patients and families. And third of all, there's opportunities for spiritual strength and coping.
This slide really is just a reminder that as people are living longer and living with more and more morbidities and complexity, having a holistic view becomes all the more important. Whatever you end up specialising in as a doctor, seeing the whole person and attending to their spiritual needs as well as their physical needs is important. These things are really interlinked, interwoven.
Yeah. There's a massive body of empirical research on the effects of spirituality on health, and this is just a summary of some of the data. What you see is that spirituality can result in improved quality of life, can be decreased depression and anxiety, improved physical well-being and coping, better adherence to treatments, better social relationships, awareness of prognosis, greater ease with decision-making, and also greater satisfaction with the decisions made about treatments. It's a massive body of research. If you're interested, Dr. Harold Koenig has the Handbook of Religion and Health, which is about 1,000 pages long of empirical studies. He also has a Handbook of Spirituality and Health and Mental Health and lots of different versions. There's specific research focused on serious illness and the role of spirituality in that. This is a study by Balboni and colleagues. And then also specifically in palliative care and spirituality, Steinhauser and colleagues.
We wanted just to ask all of you at this point, just like a quick show of hands. How many of you have encountered a patient in spiritual distress? That's okay. That's interesting. We'll maybe just unpack a little bit more about what we mean by spiritual distress. So here is a definition. Spiritual distress occurs when patients experience and can't resolve a lack of inner peace, an inability to find sources of meaning, hope, love, comfort, strength, disruption in their belief or value system, inability to accept what's happening. And just think back for a moment to that tree model of spirituality. One of the kind of questions that I added to that slide was, what impact would illness have on this? What impact would having a palliative care diagnosis have on this? People often find that actually they are then cut off from a lot of the resources that usually support and sustain them. People might find themselves asking questions about, who am I now? Who am I now that this has happened to me? Specific things that you may well hear patients saying, and I suspect that you have heard some of these things voiced. Questions of meaning, that who am I now question. I'm not the person I used to be. Statements about hope. What do I have to hope for? What's the point now? Often when someone is faced with a diagnosis that means they're going to be deteriorating over time, that's really difficult to re-find hope in that situation. Questions about mystery. Why me? Why now? Why is this happening? Often isolation and loneliness. I feel alone. I feel like God has abandoned me. I wonder if I'm being punished. So you can hear that kind of estrangement from values, those beliefs that have sustained someone up until that point. Feelings of helplessness. I've got no control anymore. I'm just a burden. This slide really is just to flag up that it's not only patients who experience spiritual distress. We know that families and caregivers, they're asking those questions too. They're experiencing that distress as well.
Another reason to really cue in onto spiritual distress as a physician is that this affects your healthcare outcomes as well. You've got greater physical pain and perception of pain when a person is in spiritual distress. You may have seen that already in your rotations. But there's also depression, anxiety, diminished quality of life, lower satisfaction with life, and also suicidal ideations or requests for euthanasia. Now that we've talked a little bit about what spiritual distress can look like, think back and how many of you have encountered patients in spiritual distress? Yeah, you can just nod your head if you don't want to raise your hand. Yeah, lots of people. So any of these sort of statements should sound an alarm in your head that there's more going on here with this person. And the things that they say, they really deserve someone who's got the time to listen and unpack them further. And that's part of what Cara, the chaplain, is for, is that she's got the time to listen to a person as they need to process these sort of things and these sort of questions. So, welcome to everyone joining. So, when patients make statements like you just saw of, my life has no meaning, I've got no hope, I'm just a burden, what you'll see is a lot of clinicians will just skip over them or pretend like they didn't hear it. And so don't be that person. Like what they said, actually, it deserves to be acknowledged. And you can always circle back. You can say, I want to hear more about this, but first let me just finish your list of medications. Or you can say, hey, that's really important. Let me refer you to a colleague of mine who can talk about this with you more. And so it doesn't have to be this really big, emotionally draining, time-consuming thing. It's just acknowledging it when someone makes a statement about spiritual distress.
And as well as kind of having your antenna up for spiritual distress, we also want to just encourage you to notice and recognise spiritual strengths and coping. For many people, their spirituality is a great source of strength and comfort and help. And there's a list here just giving some examples of the ways in which people's spirituality can support them. As a chaplain, when I'm meeting someone, I'm finding out from them about their beliefs, their values, their spirituality. The question at the forefront of my mind is never, do I agree with this person? Do I share their beliefs? It's, are these beliefs helping them, supporting them, or hurting them, harming them? You know, that's what's important. And it's absolutely okay for us to care spiritually for people who have beliefs that we don't share, or practices that are different from our own. Imagine that you meet a patient who loves weightlifting. You don't need to be an expert in weightlifting to listen to what it means for them, to hear them tell you about why that's important for them.
Can I add? You were saying that people might have views that are kind of, or sort of things that are sort of helpful for them or harmful for them. How do you manage it if you feel like someone's spiritual beliefs or kind of the outlook that they're having is harmful for them? Because presumably, particularly if you don't share that spiritual belief, you don't want to necessarily guide them in another direction. That's a bit sort of,
that's a really great question. And I guess it's about acknowledging what you're hearing. If it's a belief that's causing them distress, just exploring that with them, giving them a space to talk about it, to tell you more. And also, again, exploring what are the strengths, what are the things that help them to cope, what's helped them in the past. Sometimes I will gently challenge beliefs if I feel that they are really unhelpful to that person. But I guess one of the hard learnings of this role, and I'm sure you'll come to learn this as well in your role as medics, is actually the most helpful wisdom comes from the person themselves. Usually they know what they need. They have their own resources. And hope isn't something we can kind of present them with or do for them. And we'll talk a little bit more about that as we go through, about the idea of fixing and what we do with these situations that feel unfixable. It can be helpful just to hold and name those things and explore them with space.
Yeah, well, we'll talk about, you're jumping ahead, we'll talk about this a little bit more, but you can always just say what you notice and see. Say, hey, it seems like this is causing you to feel lack of peace, or it seems like this is affecting you. Tell me more about that. And so you can just say what you notice.
Yeah, absolutely. And we also know that addressing spirituality helps patients in their recovery, as well as there being lots of empirical studies that demonstrate that. It's something we hear anecdotally from patients. Patients tell us, this helps me, this is helping me to get better. To give a kind of concrete example of that, there's a particular patient that I visited at the Churchill Hospital over a long period of time after he'd had stem cell transplant. He was in hospital for a long time, he had lots of complications following his treatment. I visited him regularly, but it never felt to me like we were having a particularly in-depth conversation. Mostly he talked about football, we had kind of light-hearted banter. I was just a familiar, friendly face that kept popping in. He recovered, he got better, and he kept in touch. And he still sends me messages now and again. And the thing he consistently says to me is, "You saved my life. You're the reason I'm still here today." Obviously, his anti-cancer treatment was a really big part of why he's still here today. But it's really interesting, isn't it, that having that support, having that human contact throughout his treatment, he ascribes that as being crucial in his recovery.
So when it comes to spiritual care, it's really two sides of the same coin. Like spirituality can be about connection, and you can have distress from I'm alone, I'm isolated, I'm disconnected. Or you can have incredible strength from I've got a community around me, I feel in connection with God or others or nature. Part of spirituality is peace. You can have the distress of I can't find peace, I can't accept this, I can't forgive. But you can also find the strength in the ability to forgive even yourself for the things you left undone, the ability to accept or find meaning in the illness going on. So two sides of the same coin, and you as clinicians get to be on the lookout for which way is this person going? How can I help them draw on their spirituality in a way that leads to strength and coping? Also, why you should care about this as physicians is just part of cultural competence and also humility and being able to listen to other people. All right, what is a chaplain? We have one.
I'm hoping that some of you might have seen chaplains around in the places that you've been working. If you see us, please do say hi. We're human and we're friendly. Chaplains are employed by the organisation, and we're employed to support the spiritual care of the whole hospital community. So that's patients, visitors, families and staff. And we're also employed to help support the spiritual care of people of all faiths and none. Many chaplains are faith leaders, but not all chaplains. Some chaplains are humanists, some are atheists, are lay people, so they may have from a faith tradition, but they're not ordained. We are governed by a code of conduct set by the UK Board of Healthcare Chaplains. We are never coming around to proselytise or to impose our views, our beliefs on anybody else. The care that we deliver is always patient-led, boundaried by our code of conduct and the policies of the organisation.
We have a little video that shows some of the roles of the chaplain.
Welcome back. It's 4:43 now. Being in the hospital can be a stressful and emotional experience. That's why after doctors and nurses leave the room, chaplains are available to provide spiritual care.
I just knew I needed the help because I cannot breathe.
A visit to the emergency room left Polo with some devastating news.
Right here in the hospital, they find out my kidneys fell.
Unfortunately, even with dialysis treatment 3 times a week, Polo doesn't have much time left.
They told me if I don't do dialysis, I can die in 10 days.
Intermountain Medical Center's chaplain, Rosemary Barron, is there for Polo with spiritual support.
Spiritual support sometimes is simply listening.
For others, it's praying together or finding resources in the community that support a patient's needs.
But I think the biggest role of the chaplain is to be present. And to be present means that you are with a person and walking the journey with them in a spiritual sense.
The support of a hospital chaplain isn't limited to a specific faith or religion.
It might be how they feel about God. It might be that they don't believe in God. We never really quite know. And yet being present and listening is the most important role of the chaplain.
Polo and Rosemary pray together and talk. With her help, he's become at peace.
If you are ready to go. Anytime God wants to take me, I'm ready.
She's also helped him explain the acceptance of his future to his loved ones.
When they told me that I have 10 days, I explained to them that it was time for me to go.
Now, if you or a loved one are in the hospital and you'd like a visit with a hospital chaplain, all you have to do is tell your nurse or doctor.
It's quite a nice little testimonial there. As I said, chaplains are part of the multidisciplinary team. We do attend MDT meetings with some of the teams in the hospital. We're available to attend family meetings, discharge planning meetings, if that would be helpful in supporting the patient and supporting clinical teams. We, as members of the MDT, we have access to EPR. We do make entries in the patient's medical records when we've been to visit them, so look out for those. They might have useful information about the patients you're looking after. We often are advocates for patients. You know, we sometimes will help them to express their wishes, their needs. The clinical team's looking after them. And we also provide spiritual support to staff. That is a big part of our role, and a part of our role we take seriously. And lots of people maybe aren't aware of that. They know that we're here for patients, but they don't realise that we're here to care for staff as well.
So a way you can think about chaplaincy is in this sort of generalist specialist model of care, where you as physicians, you're the spiritual care generalist. What your job is to do is to listen, to provide a really compassionate presence and silence and attention to your patients, to be on the lookout for spiritual distress, spiritual coping, to ask about religious and spiritual beliefs that have implications for someone's healthcare treatment plans. And then also part of your responsibility is to refer to a chaplain when things need to be unpacked further.
We recognise that time is a really scarce commodity for all of you. Chaplains do have time to listen, and that can be a really nice way of introducing or offering chaplaincy to patients. It's just to say, this is someone who's got time to spend, time to listen. So do refer to us if you're noticing that somebody is in spiritual distress, they have complex needs, or you're noticing that there are ways of spiritual coping that they maybe need help and support to access. Also have this idea of a little pain in mind. If someone's got symptoms that aren't readily responding to the medical treatments you're giving, maybe the pain we're seeing is the tip of the iceberg and there's more going on for that person that's contributing. Chaplains often will help to facilitate ritual, and I'll say a little bit more in a moment about what ritual is and what it does. Please do refer to us early. It's great if we can meet someone in time to build that therapeutic relationship with them. We're not just there for religious patients. We're not just there for dying patients. And remember families, we're here to support them as well.
So, like Cara said, there's always the problem of time in medicine, and a patient will say something that warrants unpacking further. And so you can send this person to the chaplain to unpack that. Yeah. And then also, you had another comment too.
Yeah, just also sometimes there might be, you might go into a conversation with an agenda. There's something that you need to discuss with that patient. Maybe you need to talk about their DNA CPR or their treatment plan or their feeling of care. But it might be that there is too much distress for you to have that conversation. Sometimes having a conversation with the chaplain first can just clear the way for you to have the conversation you need to have. We can hold and work through some of that distress, and it might then be easier for you to have the decision-making conversation that you need to have. And yeah, I just wanted also to say something about creativity in spiritual care. Spiritual care is often creative. It's the kind of extra mile stuff that we do, and the stuff that's really tailored to the individual. Also, we have to be really creative in delivering spiritual care within the constraints of a clinical setting, all of the disruption that entails. So sometimes it's about being creative with what we've got, with what we've got to work with. I'll just offer a couple of brief stories just to illustrate that. There was a patient, a woman that I was supporting for a time on one of the wards here at the Churchill who was really, really anxious. Hated being on her own, was finding being in the side room where she was really challenging, really wanted staff to stay with her, hold her hand, and she was referred to chaplaincy so that we could provide some of that additional support. And in the course of getting to know her and asking her to tell me about her life and the things that she'd enjoyed doing in the past, she talked about a favourite beach on the south coast of England where she used to regularly go for holidays. It's a really special place for her. She was able to describe it in great detail. So I started to explore with her, is there somewhere you could go in your imagination when you're feeling really anxious? And we talked about ways of doing that, and we practiced it together, and I printed some images of this particular beach and we stuck them on the wall opposite her bed. So just a simple example of just being a little bit creative, helping to support the resources that people have. Another example comes from a recent situation when I was supporting a patient on oncology ward, a young man who had a really devastating diagnosis and was deteriorating very quickly. He had a young family, a wife, 2 young children and a third child on the way, and I spent a lot of time with them, listening to the distress and with them as they were kind of coming to terms with the situation and what was happening. One of the things they told me was they had a scan booked in a few weeks' time where they were going to find out the sex of their child. And in conversations with the palliative care team, I realised that time was short, that things were changing really quickly, and I just asked the question, could we do that scan here? Could we do it at the bedside on oncology ward? Could we do it sooner so that he can be present? And between us, we kind of called in favours, got in touch with maternity, used our contacts there, and the following day we were able to offer that on the ward. So the patient's wife had her ultrasound scan. He was really tired by this point, but he was just about awake and aware enough to see and understand what was going on. They were able to listen to the baby's heartbeat together. They found out together that they were having a little boy. And he died actually that night. He went on to die that night. So we just caught that window of opportunity where he was awake and aware enough for that to happen. But again, that's just an example of thinking a little bit creatively with what can we do with the resources we've got, what's important to this person, and how can we facilitate those connections for them. And I mentioned ritual. So ritual, I suspect, is something that's quite distinctive to chaplaincy, but it's something we regularly offer in various ways to patients and families. Ritual has been shown in studies to be experienced by people as completing, calming, and connecting. One very common example in chaplaincy is we might go to say some last prayers as somebody is nearing death, and that can often just be a container for lots of strong emotion. It can provide a sort of still point and a bit of a sacred space in the midst of lots of chaos and uncertainty and distress. Ritual is something that marks and acknowledges transition. It usually contains action and symbol, and it does meet a really broad human need that's, again, bigger than religion. So sometimes we will draw on the resources of faith, but we will also do rituals with people that are not particularly religious, but are collaborative. Again, I'll just offer you an example from practice. There was a woman, I met her in oncology ward. She was then moved to Sobell Hospice. She'd been living with cancer for a while, but she had just received the news that actually no further treatment and her cancer was progressing quickly, and she didn't have very long left to live. One of the things she mentioned to the first time I met her was her daughter was due to be married in 3 months' time, and she had really been looking forward to it, and it was really breaking her heart, the thought that she may not live long enough to see her daughter's wedding. So we talked about, I just offered the idea that maybe we could do something ahead of the wedding. We could have a pre-wedding blessing. And she really seemed to warm to that idea. She talked to her family about it. They were really keen on the idea. Again, the palliative care team gave me a nudge and said, we think if this is going to happen, it needs to happen really soon. I met with the patient's daughter and their fiancé. We talked about their hopes and plans for their wedding day, the music that they would be having. The family were amazing. They kind of pulled out all the stops. They organised at really short notice flowers, outfits, and we had a little pre-wedding blessing in the chapel at the hospice. The patient was wheeled in on her bed, but she was awake and engaged and taking part. I really remember her singing and dancing from bed to take that. We had enlisted a volunteer photographer to come and take photos, so they had lovely family photos together. And again, the patient died a couple of days later. Her daughter got in touch afterwards and said, you gave us our last happy memories, and those memories and the photographs we have mean so much. So again, just an example of ritual and creativity meeting a need. So just to tell you a bit about the chaplaincy team in this trust, as I've already said, we're here for everyone. That includes medical students. We are NHS staff, but we do also have a very small number of volunteers who support the work that we do. In our team, we have 7 chaplains, 6 of whom are Christian chaplains, and we have an imam, a Muslim chaplain. But we also hold a list of faith contacts, what we call honorary chaplains. So local faith leaders that we have a relationship with been through a hospital vetting process, and we call them in as and when we need to meet needs that we can't meet from within the team. We are available for routine visiting Mondays to Fridays, sort of normal office hours, but as well as that we offer a 24-hour on-call service. So we are available to attend to emergencies overnight, at the weekends, bank holidays. A really key, you can refer to us in all number of ways, however you want to really. But a key message is if you ever need us urgently, please always go through the switchboard and ask for the duty chaplain. The reason being we do our on-call work from home, so we're not checking EPR at home over the weekend in the middle of the night. We get paged if we're needed and we come in. So if you need us quickly, always go through the switchboard.
Thank you, Cara. So now we're going to talk about how you guys can start practicing spiritual care now as medical students. And it's something that you can learn from chaplains because they're very good at this. It's this presence and silence and attention. So first thing though, let's just get this out of the way. It's the comment, I don't have time. And I want you guys to read this quote for a second that's on the screen. That last line is key. Some people who came in just for a moment were all there completely in that moment. And so spiritual care, it's not about the quantity of time you spend with a patient. It's about the quality of time that you're with them. So a lot of people are afraid of spiritual care and just don't ask the questions because you don't know what a patient's going to say or what you're going to do with what they say. And when you open up questions about spirituality, you might get something like this giant knot that can't be untangled. And physicians, we're really uncomfortable with this because we like the things that we can examine and diagnose and fix and be done with. That's what we like. And when a patient says something like, my life has no meaning, I'm just a burden, we might ourselves feel helpless and have an instinct to try to withdraw from that patient or avoid them. And actually, if you can stay in that space, something really important happens. It's really in this uncomfortable space that really deep healing can start to occur. So sometimes in medicine, we need to flip into a different type of skill set, where we move out of this headspace of examine, diagnose, and fix, and we inhabit a different way of being. And what it involves is presence. It's like that quote we read about some people who were there in that moment, for a moment, fully in that moment. It also is silence. Silence is incredible because if you hold the silence, what happens is that someone will fill it. And as a physician, you really want to fill the silence with something that's comforting or something that's fixing. But if you can hold yourself back and let that space stay for the patient, they will fill it. And actually, they'll bring you to the place that they really need to go to. And so you can give your patients the gift of your presence with them. You can give them also a gift of silence. And then finally, attention. There's a 20th century French philosopher and Jewish mystic named Simone Weil. And she has this idea of love as attention. And I like to think about compassion as attention. It doesn't have to be all of this emotional, weepy stuff. It can just be your attention fully on this person and the gift of that. When you figure out how to do this, you'll realize that you have a tremendous skill that will set you free because you won't have to be afraid of having difficult conversations with patients. You can hold the silence. You can put your attention fully on them, and you can be present with them. And honestly, people don't expect you to have the solution to their life's problems or the answer to the meaning of life. But what they need is a space to be able to voice those questions and griefs, and they need you to value who they are and what they say.
I'm just going to read aloud this beautiful quote. It says, "Caring for the soul requires that we be fully present in situations we cannot control, and patient as a genuine meaning and direction unfold. It means seeing familiar things in new ways, listening rather than speaking, learning from patients rather than teaching them, and cultivating the capacity to be amazed. It means recognizing the power of our own humanity to make a difference in the lives of others and valuing it as highly as our expertise. Finally, it means discovering that healthcare is a front row seat on mystery and sitting in that seat with open eyes." So who's spiritual care for? I really hope you're taking away the message that it's not just for dying patients, it's not just for religious patients, it's not even just for patients, it's also for you. And spiritual care for you is really important. When you're doing this hard work of presence and silence and attention, you need to have a way to resource yourself and refresh yourself and support yourself. So just think back again to that tree image that we used at the beginning. You know, what are the things that support and sustain you? What are your values? What are the things that give you a sense of belonging and connectedness? And here are just some really practical things that you might want to think about doing after this session. Have a go at practicing presence, silence and attention with patients and with each other. Look out, have that alarm, little alarm in your head. Look out for those signs, those indicators of spiritual distress or spiritual coping, spiritual strength. You might like to come and shadow one of the hospital chaplains. Please do get in touch if that's something that would be of interest to you. You might want to go away and think and learn a bit more about spirituality and religions, or explore your own spirituality, or listen more deeply to find out about one another.
Some key takeaway points. Spiritual care is an integral part of whole person care. You're the spiritual care generalist. Look out for the distress, the coping. Look for opportunities for presence and silence and attention. You also don't have to do this alone. You can always refer to the specialist, the chaplain. And remember what to do when someone hands you this knot. Finally, you can connect to your own spirituality with a place you can go to refresh yourself. And often as medical students, you'll walk out the door holding things that you might not be used to holding. And you need to have a place that you can put that. And so placing that within the context of the things that give your life meaning and hope and joy will sustain you throughout your career. These are some recommended readings. Victoria can send you the slides. I will not bore you by reading references. And thank you guys for listening.
Yeah, thank you.
So thank you.